often have you heard the term slip disc, sciatica, or pinched nerve? Hi, I'm Sam from Club 360, and today we're going to be going over 5 common misconceptions related to back pain and leg pain. Let's get started. So the 5 things we're going to be talking about today: how common are pinched nerves really? Can discs slip? Is what you see on a scan what you actually get? Can core stability training fix back pain? And are squats and deadlifts bad for you? So the first myth is that all back-related leg pain is the result of a pinched nerve, or what's often called sciatica. Now, it makes sense if we've got pain that's originating in the back that we're feeling in the leg that we think that it might be caused by compression on the nerve. Now, it is possible to have a compressed nerve. Usually with this sort of problem, we have associated symptoms such as numbness and weakness. However, what's far more common is what we call referred pain. So this is where we have something going wrong in the back and the brain interpreting that as coming from the leg. And this is essentially a mapping error. We can also have a sensitized nerve. So this is basically where instead of there being more of a direct pressure on the nerve, it's more so that the nerve is becoming inflamed and is therefore sensitive to stretch. As well as having referred pain and also a compressed nerve in the spine. We can also have referred pain coming from muscles and joints such as the hip joint, and we can also have a nerve compression occurring around some of the muscles in the hip as well. We can have problems that are more what we call centrally driven, so more of a problem in terms of the brain and the nervous system being excessively sensitive. And then we can also have back pain that's coexisting with different causes of leg pain. Now, these might be arterial in nature or even something like diabetes. Now, these all must be treated differently, and this is why accurate diagnosis is really essential. The next myth is that what we see on a scan is what is causing our problems. Now, one of the most common things that we see when we image the spine is that there might be a problem with a disc bulge or a disc herniation or protrusion. Now, in the case of a compressed nerve, like we talked about in the last myth, if we have a scan that shows a disc pushing on a nerve, and then we have signs of numbness and weakness, and these signs are worsening over time, then the scan is very relevant. Scans can also be really useful in terms of ruling out nasty things like tumours and other things that may be masquerading as nerve pain. However, for the majority of cases, scans are not relevant and they often give us misleading information. If we take our age and add 10, so for me, 42, I add 10, 52% of people my age without symptoms who have never had back pain or leg pain will have some type of disc pathology on an MRI. So we've got to make sure that if we're using imaging, that we're using it appropriately and we're not just using the imaging findings to guide the treatment alone. Myth number 3, discs can slip. Discs can't slip. They can't go anywhere. If you look at the anatomy of the disc is firmly bound to the bone above and below. Now, it can and will change shape over time. As we talked about in the last myth, this is a normal part of aging in that we see some change in the shape and then we may see some bulging or herniation, but they can't slip. And if we focus too much on these discs as being causative of our pain, that can create a negative connotation with these structures and induce a sense of vulnerability and make us concerned about our bodies, and that in turn can make the pain worse. The fourth misconception is that back pain is the result of a weak core. Now, there are a lot of people that have improvements in lower back pain as a result of core training or abdominal training. However, when we look at the research, there's not a great correlation between your generalized core stability and strength and lower back pain. There's so many factors that go into back pain that when we are doing core strengthening, we're doing a lot more than just strengthening the core. We're using the muscles around the area that hurts that can just make things a little less sensitive. We're developing confidence in that general area. All these things can help with the pain as well. The other problem is that there's a lot of people out there that actually have too much tension, too much stability around the core. People that sit with a lot of tension in their abdominal and back muscles. And for those people, we actually have to use different strategies and get them to try and relax and not use those core muscles. So whilst there is that temptation to make things simple and say that if you have back pain, you need to do some exercises to strengthen your core, unfortunately, it isn't that simple. And we need to do a thorough assessment with each individual person to see if someone might benefit from those type of strategies or if we need to apply a different sort of management plan. The final misconception is that spinal loading is bad for the back and is causative of back pain. Now, when we talk about spinal loading, we're talking about exercises like squats and deadlifts, where we have load that is applied to the spine in either a compressive manner or something that we're lifting up with basically using our back as part of the mechanism with which we're using to lift. Now, load is my favorite thing to talk about, and spinal loading, those sort of exercises are just different types of load. Someone might be very sensitive to spinal loading, but that doesn't necessarily mean that the loading is bad even for that person. It just means that we need to start at a lower level of load. And this is the same way that we apply any sort of intervention, any sort of exercise, manual therapy, lifestyle intervention. It's all about picking the right type of load to match that person's current capacity. So even if you have a spine, like we talked about before, if you might have some disc pathology or even some scoliosis, some curvature of the spine, no matter what your spine looks like, it will still be able to tolerate and benefit from some type of load. But it's all about matching the type of load with the person and making the treatment intervention as targeted as possible. So thanks for watching. I hope you found that interesting and informative. If you've got any questions, comments, if you'd like to share your back pain experience, drop it down in the questions and comments, and we'll look forward to seeing you on the next episode.